video, I will take about the radiography of abdomen area for adults by using an X-ray. I'm a student Miriam Abd Hashim. What is abdomen X-ray? X-ray is non-invasive medical test that helps doctor to diagnose and treat medical condition. X-ray imaging involves exposing a part of the body to small dose of ionizing radiation to project imaging inside the body. X-ray are the oldest and most widely used for the medical imaging. Abdomen X-ray is commonly performed X-ray examination that proceeds imaging of the organ in the abdomen cavity, including the stomach, liver, intestine, and spleen. Abdominal X-ray position, we have two positions: routine study abdomen and special study abdomen. Routine study abdomen, AB supine and AB erect. The special studies are PA prone and AP lateral decapitious and lateral dorsal decapitious. Note, in all routine and special abdomen examination, imaging of the inter-abdomen from the diaphragm to the end of the pelvis bone is necessary. Abdomen AB supine, exposure factor KVP 18, mass 35, SID 100 and beam vertical. Patient perforation. It is most regular routine examination for abdomen imaging. The patient is asked to remove any metal in the bucket, for example, case. Imaging is from the lower chest over the diaphragm to the end of the pelvis bone. The way to do the examination. The patient is lie on the examination table on the block. The patient's hands are preferred to be raised up or behind the head, and they might be on both sides of the patient, provided they don't stick to the abdomen. The knees are slightly pinned up and below or spongy is balanced under. It is so that the bucket is complete and connected with the receiver or the cassette. The iliac crest is landmark in abdominal imaging and it is half cassette level. The imaging is done in the case of the patient exhalation, because in the case the patient is extended and the lunge is contracted for better view of the abdomen. The another position, abdomen AB erect. Exposure factor KVP 18 in mass 40 in SID 100 and beam vertical. General information on patient perforation. This examination is done if there is fluid in the abdomen or air under the diaphragm to take advantage for gravity and diagnose the disease because of the clarity of fluid or air better than the supine position. The patient is asked to get rid of any metal that block the breath, whether in the pocket or in the clothes. Imaging for the top of the diaphragm to the end of the abdomen below the pelvis. How this can work? The patient is in the standing position facing the X-ray machine and the bucket touch the X-ray receiver. The legs are slightly extended and the weight is distributed evenly over both legs without any inclination. Hands are slightly extended out and away from the radiation area. The iliac crest is receiving landmark in the abdomen imaging and is at the level of the half cassette. It is prominent bone in the side of pelvis and mid-abdomen that can be felt by hand and balancing in middle of the laser beam receiver. The imaging is done in the cases of the patient exhalation, because in the case the abdomen is extended and the lunge is contracted, instruction the patient to take deep breath, then exhale and then suppresses the breath while exhaling, then the imaging is taken. The benefit and the risk of abdomen X-ray imaging. Benefit is painless and minimally invasive product with a rare complication. Radiology's examination can often provide enough information to avoid more invasive proceeding. X-ray equipment is required inexpensive and widely available in emergency room, making it is convenient for both patient and physicians because X-ray imaging is fast and easily. It is particularly useful in emergency diagnosis and treatment. Not radiation remain in patient body after X-ray examination. X-ray usually have no side effects in the typical diagnostic range for this examination. The risk, there is always a slightly chance of cancer from excessive exposure to the radiation. However, the benefit of accurate diagnosis far outweighs the risk. The effective radiation does for this procedure. First,